Dr. Jason here from the National Cancer Society. Let's separate fact from fiction. So let's get some updates on the HPV vaccine. So, how does the HPV vaccine affect us? Does it make us into a sex maniac? Does it cause Down syndrome? Does it cause us to be disabled? Does it cause us to have anxiety, fear, and panic? No. So, to all of these dangerous side effects that people are afraid of, no. It does not lead to any of these adverse effects. The only thing you will experience is like that muscle man at the bottom, a bit of pain, maybe some fever, but that's about it. No other adverse effects have been reported. Right, so unfortunately there are a lot of vaccine hesitancies, but what we need to actually remember and ensure that is that Gardasil 4, this vaccine for HPV virus, has been rigorously studied, proven to be effective, and can save lives. Okay, so this is just a little bit about vaccine hesitancy. Unfortunately, there's been a lot of these things that have come about, but I'm going to ensure you that we have been trying to close all these barriers in terms of cost, in terms of some of your transportation issues, and many of these different things. And most importantly, these vaccines are safe, effective, and can save lives. Right. So the first myth is vaccine unsafe. So before licensing by the FDA, 60,000 people are studied to ensure safety. How do we do it? We monitor by ER visits, hospitalizations for 60 days post-vaccine, and we check for 200 categories of illnesses. And after licensing by FDA, 70 million doses of these vaccines are given safety monitoring in 80 countries, and no serious safety concerns have been reported for Gardasil 4 or G4, this HPV vaccine that we're giving. So, the second myth. Vaccine is unnecessary unless you're sexually active. So, what is the preventive nature of vaccine? It only works if it's given before coming in contact with the virus. Younger people create more antibodies to the vaccine, so it's better protection. So that's why you vaccinate young. And infectivity of HPV, almost everyone will be infected by HPV at some point. When you're given younger, it's more effective. It provides 2 times protection at 14 compared to 15 years old. Hence, vaccines are necessary. Even if you're not sexually active, you still need to get the vaccine. Alright? So because that will prevent you against getting cervical cancer. So the third myth, vaccine is only for females. Well, 4 in 5 of humans will get HPV or will get HPV. That's about 80% of us. Vaccinations for boys will ensure that they are far less likely to spread HPV to their future partners. And for men, the benefits is we can prevent genital cancers caused by HPV, things like penis cancer, throat cancer, anal cancer, as well as genital warts. So the fourth myth, vaccines don't work. So it's actually 100% effective for females and 90% effective for males. In phase 3 clinical trials, with 16 to 26-year-old, 20,000 of them, those women who have had high-risk HPV infections, there were no abnormalities. And for males, they used a different study, and 90% effective in preventing genital warts and abnormalities associated with penis cancer. The fifth myth, vaccine encourages sexual activity. So, study was done. Study looking at HPV vaccination and sexual activity-related outcomes like pregnancies, sexual transmitted infection testings, or diagnosis or contraceptive counseling over 3 years. We checked those who were vaccinated versus unvaccinated 11 to 12-year-old girls, and it was found that it's not associated with earlier onset of sexual activity or increase of sexual activity related outcome. So no correlation. And the fifth myth is vaccine encourages sexual act. So again, it has been debunked. Okay, it's been debunked, and these are all studies and news articles from basically all studies from Malaysia. They found that the mean age of first sexual intercourse was 15 years old. Right, 15 years old. And 12.6% had sexual experiences, and 75.7% had sexual debuts at 15 to 19 years old. So, whether the vaccine is given or not, people are going to do it. So, the vaccine does not encourage sexual acts. So, myth 6, vaccine, everyone knows about it. So, unfortunately, I would like to actually debunk this and tell you that more than 50% have no idea what a vaccine is, and 60% of parents have no idea what a vaccine is about. More than 50% have no idea. So 60% of parents have no idea about the vaccine. This was a study done in 2012, and I don't think the numbers have got any better. So the provider recommendation is the single best predictor. Basically, doctors, nurses, governments, and healthcare providers are the best recommendation. When we give a recommendation, that's the best predictor. Right, so these are just some studies done in 2017 in California, asking people and getting to decide why they don't get their vaccines. Right, the most important is the doctor felt it was important to protect against future HPV infections, hence most people got it. Hence, healthcare provider recommendation is important. Seventh myth, vaccine kills people. So, 100 million doses were given worldwide, and 14 deaths only 14 deaths were reported worldwide. Right, from 100 million doses, only 14. And these causes of deaths were unfortunately from car accidents, suicide, lupus, pneumonia, and congenital heart problems, all of which were not directly related to the vaccine. It's just, oh, they got the vaccine and they got a car accident. Oh, they got a vaccine, committed suicide. So, not related directly to the vaccine. So the adverse reaction side effects will be the same as every other vaccine: pain, swelling over the area, and allergic reactions, if ever. Finally, myth 8, vaccine causes infertility. No, there's no data. Vaccinations protect women's ability to get pregnant and have healthy babies. And it actually works to protect fertility because it prevents a gynae problem like cervical cancer. So, vaccines effectiveness. So the ninth myth, the vaccine's effectiveness wears off. Currently, no, we're still checking. Basically, studies are still being done. Antibodies are still persisting. Antibodies are still present even 5 to 10 years, 8 years, even after the vaccine. So there's no indication that the effectiveness will decrease over time. Right? Long-term immunity so far, if it wears off, then we give. Right? So let's say the immunity wears off, never mind, we can give a booster, similar to hepatitis B antibody levels. Finally, vaccine has harmful ingredients. Yes, so a vaccine have aluminium. Like all vaccines, HPV vaccines have aluminium immune response booster. And this aluminium is also found actually in breast milk, infant formula, antacids, and numerous food products like cereal, nuts, dairy, honey, fruits, and vegetables. So it's just a very normal mineral. So the aluminium contents in the vaccine is so low. An adult needs about 7 to 9 milligrams of aluminium a day in their diet. The vaccine only has 0.2225, which is very low, and is reviewed and found safe by the Global Advisory Committee on Vaccine Safety, World Health Organization. Right? So lastly, if you already got vaccine, you don't need to check, right? No, false. It's important that women continue to be screened for cervical cancer even after getting all recommended shots of HPV vaccine. This is because the vaccine does not protect against all types of cervical cancer. It only protects about 95% cervical cancers. 5% you still need to get checked. And these are the cervical cancer screening guidelines. Right, pap smear every 3 years and HPV DNA every 5 years. So HPV vaccination is safe and effective. Get vaccinated now to protect against HPV-related cancers. Right, that's it. So please, if you are a woman and you have not gotten vaccinated, or you have girls who have not get vaccinated, please get vaccinated. It will save their lives.